Welcome and thank you for tuning in to Psychology Is, another episode of this podcast, and I have a special guest with me today, Dr. Christina Bjorndal. Welcome, Christina.
Thanks so much for having me. It's great to be here.
My pleasure. It's, I don't even know how well you remember this, but this is the second time our paths are crossing. You were part of my dissertation project when I was completing my PhD. I was very interested in the topic of various mental disorders and the treatments that we use for mental disorders. And I ended up focusing on the orthomolecular treatment of schizophrenia, the nutrition-based treatment of the construct of schizophrenia. And that involved me doing a multiple case study on individuals who were implementing an orthomolecular protocol. And for people who are not aware of what that is, it's essentially when a person is using a protocol of large doses of nutrients, usually in the form of vitamins, to treat their condition. And so I found multiple people who were already using that protocol. And as people may know, a case study involves an extremely in-depth investigation of a person's experience. And so I interviewed each individual for many hours. I interviewed their parents and their friends and their doctors. And so you were one of the doctors that I interviewed. So that was about 10 years ago.
Weird.
And here we are again, talking this time in the context of this podcast where I want to focus on your fantastic book,
Thank you.
Beyond the Label, 10 Steps to Improve Your Mental Health with Naturopathic Medicine. I found this book to be awesome. Highly recommend it. It's like this beautiful, it's this beautiful balance between a very personal account of your journey, your descent into depression, your ascent into madness, your 6 different episodes of mania, your multiple suicide attempts, your very, very arduous journey toward experiencing a level of mental health instability that I think many people are desperate to experience. And then you provide what I find to be a comprehensive overview of how a person can, improve their mental health. So congratulations on writing this book.
Thank you.
I imagine it's helping many people already.
Yeah, thank you very much. I think the thing that I'm proud of with the book is it's been out for 7 years and it sells copies every single month.
Nice.
And it's in 13 countries now. So that's, I'm very, it's probably time to give a little bit of an update because of course I've learned more and grown more in the last 7 years. And actually it's interesting. I left a lot out of that personal journey. So I get that comment a lot in the sense that people say, goodness me, that was really brave of you to share so much. And I think, oh my gosh, I shared so little. Can you only imagine if I had shared at all?
Wow. Yeah. That was actually the, my first introduction to you was actually when I attended the conference. I think it's called Orthomolecular Medicine Today conference in Vancouver. And I think that was in 2014, maybe 2013. And you gave an extremely powerful account, also very limited, minimal account of what you had gone through. And so I remember that being kind of one of the first impressions I got of you was of a certain courage and just a profound depth. I think anybody who endures such intense suffering comes out of it a very deep person. So I definitely got that impression of you. I would love to, explore many, many aspects of this book. And even though this might be remedial for some people are well aware of what a naturopathic doctor is. But I think for some people, it might need to be a bit demystified. And I think you lay out very nicely these 6 principles that guide naturopathic doctors. So to be clear, this is a medical doctor, right? This is a equally legitimate level of education. And I don't know if the Psychology Is audience questions that at all, but I think some people do. I mean, some people question anything other than the most conventional form of medical doctors. Some people question the legitimacy of anything outside of that. So just to clarify for people, as you write in your book, the 6 principles that guide naturopathic doctors and that define the way in which you practice are: 1, you treat the cause. So it's seek to identify and remove the underlying causes of illness.
Mm.
First, do no harm is another principle. Third is treat the whole person. Health and disease involve a complex interaction of physical, spiritual, mental, emotional, genetic, environmental, and social factors. And so NDs treat the whole person by considering all of these factors. Fourth principle is to view yourself as a teacher, that it's important to educate and encourage patients to take responsibility for their health, which is one that I particularly love. And then 5, use the healing power of nature. Use natural therapies that encourage the body to heal itself. And just a note on this, my perception, again, I think there's some percentage of people in the world who hear the term natural healing methods and are a bit dismissive of that, as though if it's not synthesized in a lab and it's not a pharmaceutical product, then, can't be that effective. But I would really highly encourage people to think twice about that, because obviously the earth provides extremely potent chemicals that perform profound functions in our body. So use the healing power of nature. And then 6, engage in prevention. The ultimate goal of naturopathic medicine is prevention. And this is accompanied by teaching and promoting lifestyle habits that foster good health. So again, in an effort to kind of demystify what naturopathic medicine is, I wanted to read those out, and I appreciate you laying them out in your book. So tell us, how long have you been practicing naturopathic medicine? In what form is your practice in currently?
So I've been practicing for 20 years, and I primarily focus on mental health and well-being. And since writing my book, so prior to writing my book, I would say my practice was split about 70% in the mental health realm, and then 30% with fertility and hormones and female supporting women in their hormonal journey. And then when the book came out, it became 100% mental health. Right. And over the last 7 years, really, well, even just this last year, I would say it's still 80%, maybe 20% now back to the women's health piece. But and it's important to understand that a lot of women with hormonal issues present with depression or anxiety. So these can be the symptoms of a problem that we might think, oh, depression, we immediately think, oh, that's neurotransmitter based, that's the root cause. But oftentimes it's hormones that present as the root cause. So that's a really important principle in naturopathic medicine, as you just mentioned, is finding and determining what is the root cause. And now, having said that, sometimes there's more than one root. A tree doesn't have just one root, right?
So I want to kind of get into the science of like the kind of the 3 major systems that you talk about supporting physically: the neurotransmitter system, the hormone system, the detoxifying organs. But maybe before we dive into that, I would love to address kind of the first half of your book, your personal journey. Now, I know that you've shared this story in your book and on other platforms, and that we don't have enough time to go into a detailed account. And I kind of have a main question I want to get to as well. But I'm kind of almost hesitant to ask you to even summarize your story because I don't want to like cheapen it by giving a short version of it.
Yeah.
But can you give the audience a sense of kind of your personal journey with mental health?
Yes, absolutely. Yeah, it's always difficult to answer that question because,
Yeah.
But the shortened version is I started struggling in high school with bulimia, and I'll just preface this by saying that I'm an overachiever type, and that actually stems from being adopted. So that's important now to understand because adoption is a trauma. In fact, there's a quote that says, adoption is the only trauma where the adoptee, that's me, is expected to be grateful.
Yeah.
So it's very powerful. And I'm not saying I'm not grateful, but the expectation and the dishonoring of the stress that can happen in utero, which is not often acknowledged. So anyways, I come into the world wired, already sensitive, already hyper aware, and with this belief that I'm not good enough, I'm not wanted, I'm not lovable. So that's the operating belief system that's driving me to then, well, I've got to be perfect in the world in order to not get sent back. Now, of course, this isn't logical. This isn't something I'm speaking about to my parents. It's just all happening within the subconscious. So you'll often see that in overachievers. They're overachieving to compensate for some sort of lack that they feel within, some sort of dark stain that they don't want to show anyone. So here I go marching through the world, and now I'm developed bulimia. Then I get to university, and the pressure gets more. And I find myself in a place that I've never been before, which is depressed. I don't know what this word means. I only understand it in the economic sense because I was a commerce student. So, okay, fine, I'm depressed. Take this medication. You'll feel better. Off I go. And then 3 months later, I spiral into another place that I've never been before, which is having a full-blown psychotic manic episode. So that episode culminated with 6 people wrestling me into a straitjacket, and off I went to the hospital. And then now I've been given a new diagnosis. No longer am I depressed and anxious with bulimia. Now I have bipolar disorder type 1, another word I knew nothing about. And what I did with that was I was not having anything to do with that. That wasn't happening to me. Thank you very much. And I'm like, the question that was in my mind was, well, perhaps I had a reaction to that medication. But I was told by my doctor that no, people with this diagnosis do not have only people with bipolar disorder experience psychosis when taking SSRIs. So now so we fast forward, I graduate, I'm working in the corporate world, and I'm wearing this mask that I've got it all together on the outside, but really this inner critic was constantly beating me up on the inside. You're not good enough. You're not smart enough. You're not, etc. enough. Good enough-itis was probably the correct diagnosis for me. So anyways, I had a suicide attempt in 1994 that left me in a coma with kidney failure. I was on dialysis. I was told I would need a kidney transplant. And I can tell you when I came out of that, I was not happy to be here. And I was even more depressed, actually. And so a friend gave me a book to read by Marianne Williamson called A Return to Love. And there's a quote in that book on surrender. And basically, there was a key word in that quote was relating to the word love. And that caused me to stop in my tracks because I had no understanding of what that word meant. I had an understanding perhaps to love an animal, to love a human, but to love myself? That was foreign. So then I thought, okay, there's got to be something here that I'm missing. I'm missing, and I'm taking 5 psychotropic meds. And I want to be clear here. I'm not against pharmaceutical medication, but that should work. You shouldn't feel worse as you're going along. And I'm now, goodness me, how many years into the journey? At least started in 84. So now we're at 94. I'm a decade in, and I'm not better at all. So that's your first clue that something's not working right. So there you go. I ended up realizing, and the same friend said, why don't you see a naturopathic doctor? And I went to a naturopathic doctor, and I also learned about Abraham Hoffer I went to the conference as well as the Mental Health Regained Public Forum I went to in 1998, I think it was. I became a patient of Dr. Hoffer's in 1999 and started his nutritional protocol along with what my naturopathic doctor was doing. And that year, from 99 to 2000, I had my first depression-free year, not 1 month of depression in that entire year. And I could not speak to that. I could not say that for the 15 years prior. So I knew there was something to what I was doing that was different than what I had already been doing. And then here, the rest is, that's the shortest, longer version of the short version.
Right. Well, thank you
Yeah.
for doing that. And again, I hate to ask you to kind of summarize something that was across such a long span of time and so complex. But thank you for summarizing that. And I want to mention, a little bit about who Abram Hoffer was. I knew you were a patient of his, and so I kind of prepared just a little bit of information to give people context, because this is a major figure, especially in the history of any kind of nutritional approach to medicine. So people know Abram Hoffer was a Canadian psychiatrist who lived from 1917 to 2009. He was known best for his pioneering work in the field of orthomolecular medicine. Orthomolecular basically translates to right molecule or correct molecule, which is a form of medicine that emphasizes the use of large doses of nutrients to treat mental disorders, on the premise that it is quite possible that what is presenting as a mental disorder is being caused by severe deficiencies in nutrients. So Abram Hoffer, he wrote over 30 books and over 100 scientific articles, and he paid special attention to schizophrenia and the use of especially high doses of vitamin B3 or niacin as a crucial ingredient of a treatment protocol. So it's so cool that you got to work with him. And so just to make it really clear, what do you attribute the success of that approach to? What do you think was kind of some of the main factors?
Mm-hmm. So I would say, and I'll be clear here. I mentioned that I had that first year, right?
Mm-hmm.
That was not sustained though. So I did bump into another depression. But that initial success, I think, was attributed to the nutrients. So one question that no one asked me, not even Dr. Hoffer, was, what was I eating? And now maybe he might have alluded to the nutrition piece, but I, as a patient, wasn't forthcoming about the bulimia. So I will own that for myself. Yeah. Doctors didn't ask me the right question. I wasn't forthcoming. I wasn't going to divulge the information. It's really important for people to understand, because if you're a patient listening, and we're all patients, right? Any human being, you're a patient. So if you're not going to be upfront with your doctor, they can't read your mind. So you need to disclose. Yeah, and you have to feel safe enough to do so. So nevertheless, the nutrients is what I attribute that to, but it wasn't sustained forever because that was only the physical level. I mentioned earlier I had an inner critic, right? So the framework that I have encompassed or that I teach is physical, mental, emotional, spiritual, those 4 levels. And if you visualize those like circles, like a bullseye, center being the spirit, if there's an influence, so you can work on the outer layer, which is physical, but eventually you will bump up against your thoughts and your emotions and your soul. Yes. And so it's important to work on, I think, because I'm a very deep empathic person, I think it's important to work on all 4 levels. Some people can get away with just the physical level, that's fine.
I agree with you. And even I think that if a person were to only address the physical level and that there were something not right about those other levels, that it would kind of, to some degree, undermine the work they're doing on the physical level. I mean, even with the example of if a person's thoughts are generating stress regularly, well, then you're going to experience like that chronic cortisol exposure, and it will undermine your efforts to improve your physical health. So, completely agree with that. The question that I mentioned I kind of had in store, related to your personal journey. So in chapter 8 of your book, you highlight, that you've been stable since 2008, and you were pondering questions in the book. Am I cured? Are we ever cured? And you wrote, does the propensity to become unwell remain in the recesses of my mind? So such an interesting question. And perhaps the propensity to become unwell is in the recesses of everyone's mind. But of course, for a person who has had 6 manic episodes and multiple suicide attempts, it's much more pertinent, that question.
Yeah.
And I know there are people out there listening who can relate to this question, who feel that their sanity, their stability hangs on a thinner thread than the average person. And so will you speak to those people who can strongly relate to this question? What guidance would you offer a person who feels like this, who is wondering if their propensity for unwellness is not very buried in their mind?
Yeah, absolutely. And I'll just preface this question with where this came from. So there was a documentary that Dr. Hoffer did called Masks of Madness, pardon me. Masks of Madness, correct? And this came from a psychiatrist who was interviewed in that documentary, who said that you are never cured, and you will always have the propensity to become unwell. And that stuck with me because I thought, is that true? And how do you know that to be true? So that's where that came from. That's where this thought process was instigated in me, because I don't believe that to be true. Because I believe that if you have dealt with and managed, now this is a condition that I'm going to say needs to be managed well, whether it's schizophrenia, bipolar disorder type 1, or anything else listed in the DSM manual. In my view, healing is possible. That's my premise and my belief. Now, there's ways to manage it. If you aren't managing those pieces of the puzzle that I talk about in Beyond the Label, those 10 steps, then yeah, but the potential is there. But the potential also exists for it not to be there.
Right.
Because that's basically the way the world is, the yin and the yang. You cannot have one without the other. So if the potential exists for you to be unwell, that means the potential exists for you to remain well.
No.
So I choose to put my emphasis there. And remember, you brought up a very, very important piece of this puzzle, probably the most important piece of this puzzle a minute ago, which was discussing stress. Right? How the physical level, if you're not tending to that, that physiological stress can result in a psychological stress in the body. So if you think that you're going to become unwell, that thought, what we want to understand is thoughts create neuropeptides. Neuropeptides affect the hormones that get produced, and those hormones in turn affect how you feel. So it's a bit of a chicken and an egg problem we have, and this is called psychoneuroimmunology. This is a work initiated by Dr. Candace Pert in her book called Molecules of Emotion. So there's only 2 states, essentially. We can break it down simply: love or fear. In science terms, sympathetic state, parasympathetic state. Healing happens in a parasympathetic or love, calm state, not in a state of sympathetic or stress. So the thought that, well, I'm going to get sick again, which side of which side is that on? Is that a calm thought to think? Or does that move your nervous system into fear and protection, right? So that's what happens when you think that you're going to get sick. You're probably going to get sick.
Right.
Right? So we really underestimate the importance of this system I just mentioned, this psychoneuroimmunology. So thoughts affect your physiology. It's a very important piece of the healing puzzle. And so that's why, I mean, that's not the only reason why I have remained well since 2008. I think it's all the practicing of the 10 steps that I talk about. And I still have to catch my mind, right? So staying as much as you can in the present moment, because when you're thinking about getting something, where are you living? In the future, right? But that's not where we are. Right now, we're in the present moment. But what you think about the future impacts the present state, right? And then this gets into the psychology of working with catastrophizing and fortune telling and what if thinking. So so I want to leave people with a message of hope and the power of possibility for your life. That healing is possible.
Yes.
Yeah.
And it's like even kind of opposite of the example you gave of like the thought that I'm going to get sick causes me the stress that can make it more likely that I get sick. And on the other hand, the thought that it's completely possible that I'm not going to get sick is calming. And then that calming effect makes it more likely that you're not going to get sick. And I'm personally have always been fascinated by the mind-body connections that we're talking about here. And it's fun to think of examples of the power of the mind to influence the body.
Mm-hmm.
And for anyone who's still feeling that out, I think perhaps one of the easiest examples to kind of prove it is the placebo effect. You know, you can look no farther than the placebo effect if you're looking for evidence that the mind has the power to affect our physiology, that our thoughts, our expectations have the power to affect our physiology. And there are just astonishing examples of the placebo effect, to the point where at this point, if someone runs a clinical trial and they're testing some new drug or something and they don't control for the placebo effect, that evidence isn't even taken seriously. That's how well established the placebo effect is. So yeah, I love that answer. And it's, you know, I think that's very reassuring for people who wonder if another bout of, you know, depression or mania is in their future. There's no real valid reason to believe that.
Yeah.
And if it's possible that would happen, then like you said, it's also possible that it wouldn't happen. That's really beautiful. I want to zoom in a little bit on that bullseye of those layers you were talking about. And I know that, you know, everyone thinks of the physical as the same thing. Everyone thinks of the mind and thoughts as the same thing. Everyone thinks of emotions as the same thing. But when you get to spirituality, it, of course, is much more open to interpretation, what that means, how that manifests for an individual, their subjective experience of spirituality can be quite unique. And so I'm curious just to hear you speak to, like, how do you define spirituality? And why is this so important for our mental health?
So I define spirituality as not religion. So that's not to say that if you have a religion that you're practicing not to do so, you know, because that is an important piece, but for many people. For me, spirituality is a connection with this essence that is greater than us. So there's many terms people use. I mean, many religions use the term God. You could use the word the universe, creator, creatrix, you know, the great earth, the divine father, whatever word, you know, that floats your boat there. Those are just words. I'm speaking about an essence. And the difference between you and me and a cadaver is life flow. In other other systems of medicine, Chinese medicine, they refer to that as the qi. In Ayurvedic medicine, they refer to that as prana. In Western medicine, refer to it as breath, right? That's the gift of life, right? When a child is born, what is everyone waiting for? Waiting for sorry?
I said the first breath.
The first breath. You haven't heard anybody say, I'm waiting for my child to take their first heartbeat.
Mm.
And what are we waiting for at the end of someone's life?
The last
breath. That's right. Soul in, first breath. Soul out, last breath. So that's my definition of the soul, or the spirit, if you will, is this essence that is you, the spark of life that is you, that is derived from, we don't know exactly where, right? Again, depending on your religious viewpoints, that may influence and color how you answer that question. For me, and here's the thing, what's very popular nowadays is psychedelics. And what is very interesting is Abraham Hoffer in the 1950s with Humphrey Osmond was working on psychedelics. That got squashed in the 1950s. So my point being that a psychotic event, to me, I've never done psychedelics, but I believe that the state of mind people are trying to achieve in a psychedelic journey is similar to the state of mind that I'm experiencing naturally with psychosis. So my point being that you see much more than, when you're in that state of mind, you see much more. You see much more on every level. And there's just more to the physical plane than what the mind's eye generally is showing you. When you can open your mind to these other altered states of consciousness, you become in touch with this other realm, is a way I'll say it. And so that leads me to believe that there's more to us than just simply the physical level. Yeah.
That's interesting because it leads me directly to a question I wanted to ask you. I've always loved the quote, and I've contemplated it often in my life, from Joseph Campbell. He said, "The psychotic drowns in the same waters in which a mystic swims with delight." And I mean, honestly, that could be one of the quotes that I've contemplated the most of all the quotes I've ever memorized. And I'm just curious to hear your thoughts on that. Do you think there's merit to that? And how do you interpret that statement?
Well, it's interesting because you shared that quote with me. And
I don't remember that.
Yeah, back in when you were working on your dissertation. And that quote from that moment has stuck with me. And I share that quote with every patient that's got either schizophrenia or bipolar disorder, and on stages when I speak. So
wow.
I need to credit you every time, but often there isn't time to share. This. But yes, I used when you mentioned that, because the quote for me that was guiding me from Joseph Campbell up until hearing that quote was, "The heart must usher the mind into the zone of revelation." Because again, many people are living their lives just right here in the neck up, from the neck up, and they're discounting the body. We have this other voice that speaks to us, which is this voice of the heart, or the intuition, or the gut. I mean, I would say there's those three voices: the gut center, the heart center, and the mind center. So anyways, getting off track. To answer the question, so you were the first person that introduced me to that, and I have been contemplating it as well. And I like that quote. I think that it's true. I think that it's absolutely true. And I think that people with, I'm going to use the word, this gift of brains that work in this way are actually the canaries in the coal mine.
Yes.
So I walked through the world, as I mentioned, the minute I got that diagnosis, I took it as a dark stain. Even my psychiatrist at the time said, "Chris," because I worked in the financial world, and with mania can come excess spending. And he said to me, "Chris, don't tell anybody that you've got this." And he meant it as a way to protect me, because he didn't want me to be limited in my career with this condition. But I interpreted it as, this is something that's so shameful, so awful, that is so repulsive that I can never share this with anyone. So, but what that did is and this is just a miscommunication between him and I, right? But what that did is it led me to cast that part of myself into the darkness, into the shadow, disown this aspect of myself. So what happens when you have a child that you lock away in the room? They're going to beg to be seen, because every part of you is welcome within the whole that is you. And when you hate something so much, it really begs to be loved, right? And that's really what, for myself, that was really when psychosis stopped showing up for me, amongst every other step in the book that I talk about, sleep, nutrition, right? Managing your thoughts, etc. But it was learning to love and accept this part of myself that I really did not like at all. So anyway, I went off on a little bit of a tangent there. So.
That's what I wanted. I wanted a long response. And yeah, well, I just think it matters so much how we frame our own experience, the words we put on it, the labels we put on it, the interpretations we make about it. And I mean, I'm, as audience members of this podcast know well, I'm extremely critical of the Diagnostic Statistical Manual, of the paradigm of framing uncommon tendencies or forms of suffering and anguish as disorders, because it has this connotation of there's something wrong with you. There's no one would interpret anything called a disorder as a gift of how their mind works. And it's like the way we frame it affects the way in which we perceive our own mind and our own nature. And then, as I often find myself saying, perception is so at the heart of psychology, and it is ultimately what is giving rise to emotions and fueling behavior. And so it's like our perception of ourselves gives rise to our emotions about ourselves, which fuels how we end up treating ourselves. And that framework that we place upon our own behaviors or our own tendencies is what primes the perception. And so it matters so much how we frame this. And it's a problem to me that too often, especially children who are haven't undergone the brain development necessary to kind of, for example, question what the doctor is saying or think critically about something. And so to impose upon a child a belief that they're defective in some way, and to frame their whatever it may be, their misconduct, their defiance, their inattentiveness, their impulsivity as a disorder, it's profoundly problematic to me. And it just completely kind of blinds them to the gift of that tendency. And of course, I'm not saying that certain things aren't problematic, right? It is problematic if a child, for example, is extremely inattentive, but that doesn't mean that the presentation of that problem is because this child is defective, right? There's so many other factors to consider, like the nature of the environment, or whether there's something going on with them biologically, or whether there's unresolved trauma, and that if all conditions were addressed, if all trauma was healed, if the environment was safe and conducive to thriving, then what would that nature look like, right? So like a child who's impulsive, I would say what that would look like, if everything else was kind of addressed appropriately, would be a super healthy, enjoyable spontaneity,
right?
Creativity.
Yeah.
And what maybe, like you're saying is maybe what psychosis might look like if all these other conditions are addressed is a certain access to peering into the nature of life with a clarity that most people don't have. a certain mystical nature about a person. So those are some of my reflections here.
Exactly. I mean, I was at a conference, as I was telling you before we hopped on, that this past weekend, and there was a chart that looked at the rise of these diagnostic percentage comparing 1950 to present day, and the percentage increase in depression, anxiety, ADHD, eating disorders, etc. And it's astronomical. I mean, I don't have the percentages for you at the fingertips, but, large numbers.
Yeah.
Large percent. We're not, we're talking 100% in the 100, and some of them 700%, like autism, for example.
Right.
Now, the question we should be asking is, well, why is that? Right? What's changed in the environment so much so that's this explosive rise? Now, one could argue that are we looking for things more now? Like you're saying, just a child that, are we too quick to label, right? Are we too quick to slap on to address something as a problem when it actually is it's not? And there's a fine line there, right? There's a fine line there. So I think that there's so much possibility and promise if we could include and incorporate the system of medicine that I've chosen to study, and to offer that first into everyone's homes and lives, that if we can think about from an economic perspective, the productivity and just if you can catch people at 3 years old and help them, get them on the right trajectory, and invest in their health from age 3 to 30 even, what their long-term outcomes would be from 30 to 60. But instead, we catch people when they're 60, and the costs are so great and they're so far down the rabbit hole, right? So really, prevention as medicine at that beginning is so important. And yet our society, we've got it reversed in the terms of our medical systems.
That's true.
Yeah.
It's interesting. I would love to dive into, the 10 steps that you talk about. And maybe one of the most engaging ways that we could talk about that is to hear you share a success story from your practice. And so as that's kind of populating in your mind, maybe I'll just read off the 10 steps that you list. So you explain, like I mentioned earlier, how to support your 3 macro systems on the physical level: the neurotransmitter system, the endocrine system, the organs of detoxification, by addressing the foundations of physical health, including diet, sleep, exercise, managing stress, and then also addressing those other levels we've been getting at: your thoughts, emotions, behaviors, environment, spirituality, and love and compassion for yourself. So those are the 10 steps that, are really worth reading about in this book, because you go into great detail about them. You have a breadth of knowledge that's just very impressive. So maybe you can talk about this by sharing with us an inspiring success story from your practice.
Well, this sounds so egotistical. There's so many.
Good.
But actually, I'll share 2, and one that's kind of. So the first one I'll share is a woman. She came to actually my very first patient ever. Very first patient ever is still my patient 20 years later. Not because she's unwell, because she wants to stay well. So she came to me after the birth of her 3rd child, and but this was 5 years. So the youngest child was 5. I think the children are 2 years apart. Very depleted and worn out and depressed. That was her diagnosis from her medical doctor. I then asked her, when did this start? What's been going on in your life? And for me, the weight of being a mother of 3 children is significant. And what's the key macro system that's likely impacted here? It's her hormones, right? So she was already on an antidepressant. So in my view, if you're already on a medication, we've got a couple of things to think about. If it's not, because it should be working, right? If it's the correct medication. So that's your clue number one. Well, then perhaps this isn't the right medication. Maybe it's not the right dose, right? That's what Dr. Hoffer taught me. The 3 rules of prescribing: dose, dose, and dose. Right? So it's always about, so maybe she's not at the correct dose, but she didn't want to increase the dose because why? A lot of these medications have side effects. Dr. Hoffer said to me, are you okay with side benefits from these vitamins I'm going to prescribe you? There's no side effects. Do you want to? Well, the only side effect with niacin is the flushing part. But anyway, side benefits versus side effects is an important point to make. So anyway, with this patient, I said to her, I think from a macro system perspective, we really need to, because we've got somebody on first base already. We've got the neurotransmitters. Let's just leave that there. I don't think we need to change to a different SSRI, et cetera. But let's look at the other 2 macro systems, and your hormones, in my opinion, have been through a lot of change in a relatively short period of time. And that's what it was. She was low in her progesterone and the cortisol was low, and the organs of detoxification. So just to outline that for people, that includes your liver, your kidneys, your lungs, your colon, your skin, and your lymphatic system. So if you're not digesting your food properly, how well are you going to absorb the nutrients? If you're not excreting and having a bowel movement every day, then you're going to be reabsorbing the toxins that your liver's worked hard to help you get rid of, because it's sitting now in your large colon. You've got bacteria there, etc. I could go dive deeper, but I'll pause it at that. So just understand that there's a gut-brain connection, a bidirectional relationship. She had antibiotic use in those pregnancies, so that disrupts the gut flora. Your bacteria in your digestive tract are responsible for making, guess what? Some important chemicals that affect your mental health. So serotonin being one of them by the bacteria. So we just worked on those, and she's been depression-free ever since. And that's 20 years. So, and that process took, before her to sort of, for the depression to lift, it wasn't that long. I think 3 months, maybe 4. But the beautiful thing about this patient and the difficult thing about naturopathic medicine is it requires you to be engaged as a patient, right? I'm going to ask you to make a change. And that's key and really important, because when you're down and out, believe me, I get it. Asking a person to go for a walk when all you want to do is lie in bed all day, this is really difficult to do. So I would also argue that the important part of medicine and our well-being is community and connection. And I can come back to an important story after about that. So you have to be able to move the needle in one thing, whether it's, drink more water, get some fresh air, eat tryptophan-forming foods that support serotonin, get to bed on time. And I mean, these things sound so simple, right? And some people listening might think, really? All I have to do is drink more water? Are you kidding me? What does she offer, rocker? I'm actually not. Right? Because these small things, your body wants to work for you, but you got to work for your body, right? The other case I'll share is a patient with bipolar disorder type 1. He had a rough go of it, sort of like me, couple suicide attempts, couple psychotic events, is on a couple of medications. And it's always a little nerve-wracking, I guess, for me, when patients just want to go off their medications, right? This is a process, and I don't endorse just seeing me today and going off your medication tomorrow. We're in this for the long game. And we're in this to taper eventually, very slowly. The key word is eventually. I'm looking for stability in you. So my goal is to not pull you off your medications right away. My goal is to build you up and get the framework and the scaffolding and the foundation of your health house solid as a rock before we begin any kind of taper. This patient was eager and didn't want to wait for me. So he ended up, and this is after, I'm going to say 6 months or so, probably 6 to 9 months. Anyways, he went off. And the nice thing was, so he started dating. This is really big for people with bipolar disorder and schizophrenia. We don't think anybody wants to date us. kind of, I don't know, maybe I'm speaking for myself, but I know he agreed with me. Like I have felt like, oh goodness, I'm damaged goods. Like who's going to want to deal with this nutcase, if you will? I'm going to apologize to myself for using that word because that's not very kind. And I don't like when people talk like that because we're not that, right? We're just human beings with who can really experience a full range of human emotions and experience. So he had a psychotic event. And then I, as a clinician, felt like a failure. Oh man, shoot. So went to visit him in the hospital and I met his girlfriend and I was so grateful that didn't scare her away because he's a great person. We're great people, right? So anyway, so we had that little bump, got back on track. And so that was in 2009, I believe. And I've been seeing him since, and he's been stable ever since. He got married to that girlfriend. He invited me to his wedding, which was amazing. He stood up at his wedding and thanked me, and his mom came and thanked me. I mean, it was so touching. But he also had trauma. He had trauma. This is an important thing to mention. One of my teachers is Gabor Mate, who's very popular right now. He says that basically trauma is not the event, but it's what you made it mean. What beliefs did you form as a result of the experience? And I was interviewed by him for his most recent book, The Myth of Normal. And he asked me, had any doctor in my 40 years of dealing with my mental health ever asked me if I had trauma? And the answer is no, not one. And so in my patient that I'm referring to, his father had died when he was 15. And that's a big loss for a young person at a significant time of hormonal shift and change. So anyhow, we're coming back to my patient. He's doing very well, very well.
Fantastic. So what exactly did you prescribe? Like what was the protocol, let's say, for this guy?
Yeah. And I'm just going to add though, he's still on a very, very, very low dose of lithium.
Mm-hmm.
But I said to him, minimum dose for maximum benefit. So if you have to stay on a micro dose, 150 milligrams, which by conventional standards is not accepted to remain well, and who's to say, maybe you'd be fine without it. I'm not, who knows? But he just feels comfortable with that. And that's what's important. It's not what I think. It's what do you feel comfortable with?
Mm-hmm.
And he's happy. Right. And anyway, but we added to that protocol. And I should say he was at 1,500 milligrams. So he's really, I think, to me, that's a success. It's not about not being on any medication, but he's also very compliant. He's very nutritionally focused. I think he eats better than I do. He's worked on his gut health. So that's been over this whole 15 years that we've been working together. We did stool testing. We've done functional hormone testing. So the protocol is really individualized to him, right, and his needs. But some of the standard things that I think every human would benefit from is the omega-3s, the B vitamins, the right form, the methylated forms of these nutrients, probiotics, and then the magnesium and specific cortisol support, whether it's calming cortisol or supporting the gas in the tank, depending on where you are in that. And that's really important, that this is an individualized approach, right? There's so many other nutrients that for him, I believe zinc was low on him. So zinc is a very important one. And I'm always supporting the pathways, the cofactors in these pathways that are involved in converting tryptophan to serotonin or phenylalanine to dopamine. We're wanting to help people convert because it might be that you don't have the cofactors, right?
Right. So do you do like any kind of blood panels or you do blood panels?
Yep.
So and you're able to see like levels of the different minerals and hormones in a person's body. See, why is that not standard practice.
I don't know.
That should be just automatic.
Yeah.
It's how
Well,
frustrating.
yeah, and I'll preface that by saying that, so for example, with hormones, testing hormones in the blood is not the best tool. It's better to use urine or saliva because hormones don't act in the bloodstream, right?
Yeah.
It's just a transportation highway, the bloodstream, right? So
Right.
it's when the hormone goes through the bloodstream, binds to a receptor of a cell, goes in the cell and does the job, right? So we want to
Right.
test the tissue level of those.
Mm.
I'm not saying you can get data from the blood. Thyroid is another important one that's often measured in the blood. Iron is also another important one. When it comes to the minerals, though, same thing, because blood has a very narrow pH, 6.8 to 7.2. It needs to be in that in that range. So it's going to pull cations and anions into the bloodstream, minerals, to maintain that pH balance. So looking again at the tissue level for minerals is better as well.
Okay.
Yeah.
And so, how would you look at the tissue level for minerals?
Yeah, you can do a urine test, or yeah, I prefer urine because and that's through. There's many labs, but the main one that I use is called Doctor's Data in the United States. Yeah, and that's very helpful. And it also can check for not only the positive minerals that we are referring to, calcium, magnesium, zinc, iron, lithium, etc. But it also looks at the heavy metals or the minerals that are not helpful to us, the lead, the cadmium, the mercury, the aluminum, etc. Because you might be totally fine, but then you've got these blockers, bouncers blocking the door, if you will, that are binding receptor sites. So those hormones and minerals can't get in. And that's a clue that that's going on. If, again, you prescribe something, you do some diagnostics, you say, okay, you're deficient in, say, zinc, calcium, magnesium. Okay, we'll support those. And then we retest and it's like, goodness, there's been no change. Well, why is that? Well, maybe, okay, so then you have to look at, well, maybe there's something from the environment. And let's face it, we're living in a very unhealthy planet, on a planet that is struggling as much as we are. The planet is struggling too. And one of my frustrations at this longevity conference that I was at was these biohacker type people were talking about, we want to extend lifespan to 150. But I'm thinking, well, what's the point if you're not addressing the health of the planet? There's going to be no planet for you to live on. So the macrocosm that's happening, the health of the planet on the macrocosm level is happening to you, the microcosm that is you as well. We are all, unfortunately, this idea of detoxification is very important. We're all toxic. I can't say it any nicer than that.
Right.
Yeah.
So hopeful. And I just think that, even thinking on a personal level, like for myself, for my children, all my loved ones, I just think I'm underutilizing the diagnostic tools we have to assess, mineral levels, hormone levels, all these fundamental physiological factors.
Yeah.
So I just think, I hope that in the very near future, this becomes much more standard practice for anybody who's presenting with anxiety or depression or anything that would qualify as a disorder, that we just start there.
Yeah.
And I mean, I always say that it's just so misguided that our approach, and when I say I mean the kind of conventional approach to addressing mental health issues is to basically just jump to really drastic measures. I consider, pharmaceutical drug treatment as a pretty drastic measure, especially if you're doing that before making sure that this person is hydrated, not sleep deprived, nutritionally, at least at a bare minimum of well nourished, and exercising, and then that they have meaning in life and social connections. If you don't address those things as your first line of defense, you're just skipping over what could very well be all the solutions you need. And then I recognize that sometimes people will have all of those things addressed, and then something will still persist. But you'll be much more able to identify the cause of whatever is still persisting if you can rule out dehydration, malnutrition, sleep deprivation, isolation, a sense of meaninglessness. So I'm so grateful, for practitioners like you who I think are approaching things the right way.
Mm, thank you. Yeah, I'll just speak to one thing that you said. So what I like to do is, and I was mentioning testing, but we can keep it simple. I have a quiz quite a few quizzes in Beyond the Label, and one of them's on my website. So if people don't have the book, just go to naturalterrain.com and type in environmental quiz. Do this environmental quiz for yourself and see. And then all the solutions are on the website as well. So just make one change.
Yeah.
The environmental piece I really want to underscore, because when I cleaned my life up from that perspective, my health just went to a whole new level. And I already thought that I was doing pretty dang good.
Right.
And I didn't know I could actually feel better. I feel the best I feel better now at 57 than I felt at 17. And that's not generally what you hear,
right,
in terms of the concept of aging, number one. And number two, I wanted to mention, I use, and it's also in Beyond the Label, and I believe it's on my Natural Terrain website as well. And this comes from, it's just a simple diagnostic assessment for anxiety and depression from Christine Bjorndal's work, Mind Over Mood. Right. And that's my scale for deciding when to start additional support, i.e. pharmaceuticals. Because say you are, so the scale goes to 55, I believe. So say you are 55, so the worst, like you're scoring worst on all of the questions, then you may need to actually, and as much as this pains me to say it, you may need to start on a little antidepressant actually, so that we can get you just a little bit up the ladder so that you can then make all these other changes, just as a short-term helping hand, if you will. The further down you are, the harder it is to make these changes. So that's sort of where I use that for myself, but then also in conjunction with the patient. Here's my recommendation, but it's really, how do you feel? Because maybe they've been suffering for 6 years before they've come to see me. They don't want to wait, or maybe it's only been 3 months. And so then I put it onto the patient. Like, you're driving your health bus. Like this is, and I know that you might need some more help here. And anyway, and I say, I know what I have to offer you is going to work. It will. It's just that it's harder work is all. Right? And if you're not able to do that hard work right now, we can make it a tiny bit easier. But I preface it by saying this is just like 3 months max. Give me 3 months. Right?
I mean, I consider that to be responsible prescription practice right there. And I've one witness to extremely irresponsible prescription practices where it's like high dose immediately forever.
Yeah, exactly. That's the message we want to leave you with, for sure, is that it's minimum dose for the shortest duration of time if you need to take a pharmaceutical, and that that doesn't have to be the first line. This can be the first line. But if you're super far down and you've just had a suicide attempt, I would say we might need a little bit more hands on deck. More hands on deck.
Makes sense.
Yeah.
Wow. I just feel so, like I said, grateful for you and people like you, inspired. And I fully trust that the Psychology audience here has greatly appreciated this as well. So from the bottom of my heart, thank you, Dr. Bjorndal, for joining me today, for writing this book, and for the work you do and the love you manifest into the world. It's a beautiful thing. So thank you.
Thank you. Yeah. Can I leave you with one story?
Please.
Okay. Because I alluded to it earlier, so I thought I'd like to share it.
Good. And
this is really for parents. This is for the caregivers, the loved ones, the support people in the lives of someone who's suffering. So there was a story of this woman and her son, but 15-year-old, 16-year-old teenage boy. They're not always the most communicative, depending.
Right.
And he was very depressed, and I think he'd had a suicide attempt at some point. Anyway, very concerned parent, and child's not coming out of his room. She's beside herself. He won't accept any help. Won't go to see a doctor, psychologist, anybody, naturopathic doctor, nothing. So she's like, what can I do for this? What can I do? I'm feeling like a failure as a mother. And so all she could think to do was make him a sandwich every day. And sometimes he ate the sandwich, sometimes he didn't eat the sandwich. But she continued for 3 months making this sandwich. He wasn't coming out of his room. Eventually, he turned the corner, and she then, a few months later, asked him, what happened there? Like, what turned the corner? And he said, it was the sandwich.
Wow.
Yeah. And she said, the sandwich? Like, what are you talking about? Thinking that this is like just not having any, like, a sandwich. Like, she's like, feeling like like I said, like, not like she's helping her child. He's like, yeah, Mom, that sandwich represented your love for me. And you showed up every day with that sandwich. I always get teared up with that. So I'm sharing that because I know I have a child, but he is very strong mentally, thank goodness, I guess, so far. But my parents dealt with me, and so people that are caring for people, just know that you might not feel like you're doing enough for your child, but it's this coming back to this concept. We need each other. We're social beings. We've just come through this pandemic. We need to connect. And you might not feel like you're doing anything as a parent, but showing up with a sandwich represented love from that boy's perspective. So what's something you could do? Doesn't have to be ginormous. Something as simple as a sandwich.
Powerful.
Yeah.
And it brings to mind that when we think of treatment protocols, maybe that shouldn't only include what the individual is doing, but what their kind of microsystem of other individuals are doing to support them.
Absolutely.
Yeah. Well, thank you for adding that. That was a nice exclamation point on everything we talked about. Well, I'm so glad we're still connected.
Yeah.
And I trust we'll stay connected.
Absolutely.
Well, thank you to all the listeners who have listened to this full conversation. And thanks again to you, Dr. Bjorndal.
Right. Take care.
You too.